Okay, so this is the report of findings. Hi, Mr. Teddy, how are you? So we got those x-rays back, and I looked at your exam and looked at the x-rays. You definitely have a loss of curve in your neck. And I'm going to show that to you here in a second. I drew some lines up there to help make it a little bit easier for you to see. So we're going to do that, and then I'm going to go through both your neck and your low back. We took the pictures too, and you'll see that there is some problem, some decreased motion in your low back and loss of curve, and that can affect the upper spine, the cervical spine of your neck as well. So let's look at that. We'll start at the bottom and work our way up. So you'll see the lumbar curve here should be around a 55-60. Yours is actually at a 45. So it's actually decreased by about 10 to 15 degrees. Not horrible, but you'll also see that there's some little points on the tips of the vertebra that kind of point out. That's early signs of arthritis. So again, not horrible, but it's a sign that we look for to see how the spine is aging and how the spine is advancing. For your age, it's actually common. It's not normal, because I have some people that are 90-year-old patients that hardly have any arthritis at all, but they've been adjusted and taken care of themselves, had no trauma and everything, that most of their life. So it's very common though to see some of the arthritic changes start to occur at your age. But it shouldn't be that severe, and it's really not that bad at all in your low back. If we move up to your neck though, we look here, the curve here should be around 40 degrees. Yours is actually almost straight up and down, so it's essentially 0. And you will see, remember those things we talked about sticking out the tips of the vertebra? We call those osteophytes, by the way. It's just bone spurs essentially. But in the neck, do you see how these two are almost fused together? There's a little space between them. And then above and below that, you'll see a couple of those as well. That is more of an advanced stage of arthritis. So that tells me that you've had some trauma, or that you've been out of place for a very long time and your body's just adapted to it. And the way it adapts to it is actually deposit some more calcium there in the ligament to help make that a stronger joint. And eventually those calcium deposits or those bone spurs can actually grow together. So what we want to do is restore the motion, get things moving better, which first of all will take you out of pain. That's our first thing we want to do. And then 2, it'll get the motion back in the spine, and will help slow that down or stop it in some cases. And then we can worry about restoring a little more curve to that neck if we can, and then worry about stopping the arthritis so it doesn't advance anymore as you get older. Any questions on that? Okay. So what I typically do with patients, just a roundabout figure based on research and based on my 20 years of experience, you're looking at probably 6 to 8 weeks to get it completely better. Your pain should start to go away here. It might even go away after this first adjustment today, but it should start to get away that first week or two. You should be pretty much out of all your pain. Then it's a matter of just restoring that motion. And when people say, well, it doesn't hurt, so I don't have to keep coming, that's a common question we get. I always use the gym as an analogy. If you go back to the gym, this is a common time of year to go back to the gym, but if you go back to the gym and you're lifting biceps, if you lift the biceps once today and once a month from now, and then once 3 months from there, are you going to see any change in that bicep? No, you're exactly right, you won't. But if you're consistent and do those biceps a couple times a week, by the end of a month, you're going to see and feel a change. We're doing the same thing. We're pushing the bone back in place. Then we're actually changing the structure of the muscles and the ligaments that hold that bone in place, which actually will help keep the bone in the right place so it doesn't go out, so the motion is moving properly between all the vertebrae, and then that will help slow things down. So that's why that takes about 6 to 8 weeks. And honestly, in our office, it happens a little bit faster. 6 to 8 weeks is good. Research-wise, muscle changes take about 12 weeks. So we're usually pretty early, but I always tell people give it 6 to 8 weeks and let's see where we're at. And then we'll always reevaluate. Every time you come in, we check you for motion and everything, and then we'll adjust you based on what you need that day. But typically, 6 to 8 weeks. So I start everybody out on 2 times a week. Your visits are, obviously today's probably your longest visit today and the first day you came in. And then after that, we try to get you in and out of here in a relatively short period of time so it works into your schedule. But 2 times a week, and then again, we check you every time. And then at the end of that 6 to 8 weeks, we'll reevaluate where you're at, and we can decide what to do from there. Any questions on that? Okay, perfect. Let's get you started.